During this section entitled Practical Pharmacy Skills, we will cover the following 3 areas. 1. Drug administration principles, or how do we get a particular drug to the location in the body where it needs to be in order to properly perform its function. 2. Basic prescription guidelines. Here we'll cover reading prescriptions, dispensing, and labeling. And finally, 3. Dealing with controlled substances, the legal protocol for handling scheduled substances. As with many of the tasks you may be asked to perform, the prescribing and administering of medications requires the utmost attention to detail so that no mistakes are made. Making a mistake in the pharmacy might very possibly have life-threatening consequences. Let's begin with our first topic, drug administration. There are 3 basic ways to get drugs to the animal. They are topical, oral, and injectable, sometimes called parenteral. Let's begin with talking about the topical route of drug administration. Here, a medication is applied to the skin, eye, or ear, where it will exert its primary effect at the location that it is delivered. Topical preparations usually have limited penetration deep into the skin and are therefore reserved for superficial problems only. We're generally applying a cream, an ointment, or a solution with these topical products. A cream generally has the thickest consistency and will retain the active ingredients on location for the longest period of time. A cream, for example, might be used to administer antibiotics to a superficial skin infection like a hot spot. An ointment tends to usually be an oil-based product and therefore has less consistency than most creams. An ointment might be used to carry medications into the eye. Solutions are medications carried in a fluid base. They are often clear and have the consistency of water. Solutions can be used in spray bottles or can be applied a drop at a time as with an ophthalmic or eye solution. Sometimes, because of their watery consistency, they are likely to disappear more quickly, requiring the owner to re-administer the medication more often. An owner who is not available to apply a solution 3 or 4 times a day may benefit from an ointment or cream that sticks around longer. Your veterinarian will probably already be considering these variables when he or she writes the prescription. Topical medications have 2 obvious disadvantages when used to treat skin problems on animals. 1. The hair must be shaved in order to gain good medication contact with the skin. 2. Many animals will lick off even the most awful-tasting topical preparations. These factors must be considered when choosing the right way to deliver the medication. A few safety concerns with topical preparations. Always wash hands thoroughly after application or wear protective rubber gloves. Always read the label to be sure that the medication is labeled for use at that location. This is especially true with the use of eye drops. Picking up the ear drops and placing them in the eye of a patient could easily lead to serious eye injury or blindness. To avoid mistakes, you need to stay focused and always think about what you're doing. With proper client education, topicals are very safe and effective ways to treat a variety of veterinary diseases. The second way drugs are transported to the patient is orally. Pills, capsules, and oral liquids are the traditional ways we think of giving medications. The key advantage to oral medications is the fact that they allow patients requiring ongoing medicinal support to continue receiving medication without repeated needles or extensive hospital stays. Many drugs that are available in an injectable form have been formulated into an oral preparation for home use. This route of administration starts with getting an animal to swallow a pill or capsule. This occurs primarily 2 ways with most dogs and cats. The first and preferred method is to hide the medication in tasty food, hoping they won't notice the pill or capsule. Dogs that are more finicky may sometimes be tricked by giving them a placebo treat first to build up their confidence that they're not being tricked. Canned food, cheese, or peanut butter often makes a good meatball for hiding the pill. Few cats will be fooled by these techniques. Manually pilling a cat is often required in order to get the cat to swallow the medication. With practice, this is a very quick, effective way to get oral medications into a dog or cat. First, hold the upper jaw with one hand. Place your thumb and index finger just behind the upper canine teeth, being careful not to place your fingers directly into the mouth. Holding the pill in your other hand, carefully open the mouth using your middle finger. Once the mouth is open, place the pill to the back of the mouth. Quickly close the mouth and stimulate a swallowing reflex by either stroking the throat area or lightly blow on the animal's nose. Hold the mouth shut until you have observed the animal swallow. Getting the pill as far back on the tongue and not on the sides is the key to successfully pilling a dog or cat. Pilling an animal sometimes requires a quick push with a finger in order to get the pill back far enough in the mouth, but be very quick to remove your finger before getting bit. If the cat attempts to use its feet to keep your hands away from its mouth, wrap the cat in a towel. Do not try to pill a cat using this technique if the cat is aggressive and attempting to bite you. You may have available a pill gun like this one shown that provides a safe way to get the pill to the back of the cat's mouth without having to stick your fingers into the mouth. Cats that get a bad-tasting medication in their mouth may react by drooling excessively. This is not a problem but can be overcome by minimizing the amount of time the pill is actually in the cat's mouth with good technique. Giving a liquid preparation is best handled by using either an eyedropper or dispensing syringe. The eyedropper is gently inserted into the side of the mouth and squirted in while the head is aimed slightly upward. Once again, we can stimulate the swallowing reflex by rubbing the throat or blowing on the nose. The third form of medication administration is the parenteral route. This means that the medication is given by injection. This is certainly the form of medicating that requires the most skill. The use of sterile technique becomes an important consideration whenever we begin depositing drugs deep into the body. The best way to assure that abscesses or infections don't result from an injection is to use a sterile needle and syringe. Be sure the skin where the injection will occur is relatively clean, and be sure the needle isn't touched or contaminated prior to the injection. There are 3 types of injections that are commonly given: subcutaneous, intramuscular, and intravenous. Let's start with the subcutaneous or sub-Q injection, as it is commonly called. This injection aims to deposit the drug just beneath the skin, where it will then be slowly absorbed into the animal's system. This is easy to remember because the prefix sub means below, and the root word cutaneous means skin. Thus, subcutaneous means below the skin. For now, we'll focus on the pharmacy aspects concerning subcutaneous injections. There are several reasons why sub-Q injections are commonly used in veterinary medicine. First, these are the most pain-free type of injections for the animal. Second, the skin of animals is pliable or flexible enough to accommodate an increased volume of injected product. And finally, the chance of inadvertently injecting into a blood vessel, nerve, or the vital structure of the dog or cat is reduced with this form of injection. Most dog and cat vaccines are given subcutaneously because of the reasons just discussed. The intramuscular injection involves placing the needle slightly deeper into the muscle. The muscles that we generally target are those of the thigh area. Understanding the anatomy in this area will help prevent injecting directly into a blood vessel or depositing the drug too close to a nerve. The muscle tissue tends to have a greater blood supply than the subcutaneous area. This means that drugs deposited into the muscle will be picked up and put into circulation much more rapidly. A drug is almost always dependent on the body's circulatory system to transport it to the tissues that need the drug. That's why in life-threatening situations, drugs are generally administered intravenously or directly into the vein, so that absorption time is not wasted. When drugs are given intravenously, they often get transported to most tissues of the body within seconds. That's why dogs given an intravenous anesthetic injection often begin to go unconscious within seconds of administration. The drug reaches appropriate concentrations in the brain very quickly after injecting the anesthetic. Care must be taken when giving an intravenous injection, not to give it too quickly. With certain drugs, this may cause an adverse reaction. Though this form of administering a medication is certainly the quickest, it also requires the most skill and knowledge of anatomy. This route also allows the delivery of much larger volumes of medication or fluids. This is most obvious when we are administering intravenous fluids. A taped-in flexible catheter allows extended injecting over several hours or days. During that time, we can give several liters or more of the fluids and medications directly into the bloodstream as needed. Intravenous injections also allow us to administer very irritating substances into the body with minimal discomfort to the tissues. This is the principal route used with most highly irritating substances. A drawback arises, however, if the needle comes out of the vein during the injection. A highly irritating substance, for example, might easily go on to produce significant pain, or the skin may even slough in that location. For these reasons, intravenous injections should be given only by those who have been trained in proper technique. Each injectable bottle will be appropriately labeled as to which route of administration to use. Some drugs can be injected subcutaneously, intramuscularly, or intravenously. Others must be given only as specified. Never deviate from these directions. Administering a drug differently than labeled is taking a risk of possibly killing that animal. So whenever you are directed to give a medication, be sure and verify how it is to be given. When handling needles, be sure and safely dispose of them into a sharps container. To summarize, the various routes for administering drugs to patients are topical, oral, and injectable. The decision as to which route involves the veterinarian considering factors of time, absorption, quantity, duration, irritation, and product availability. Because each drug is designed with an intended route of administration, it is vitally important to familiarize yourself with the product prior to giving it.